Imagine you're on a pure vegetarian plant-based diet and still face kidney issues. Well, it can happen, especially if you don't avoid some potentially harmful plant-based food sources. Take avocados as an example. This plant-based fleshy fruit is high in potassium and can damage your kidneys to a greater extent. Therefore, this video discusses the top 6 plant-based food items that you should avoid for healthy kidneys. Number 1. Canned vegetables. Canned vegetables have been used for centuries. These include corn, carrots, potatoes, and your all-time favorite tomatoes. Although they are purely derived from plants, this does not mean that you should trust them blindly. The reason you should limit your intake of canned foods lies in their high sodium content. Canned or packaged food sources often contain added salt to increase their shelf life. But this added salt can risk your lifespan and push you one step closer towards the deathbed. In fact, if you're a kidney patient, healthcare experts strictly recommend you to stop taking canned foods as they are a high source of sodium and potassium. Both these minerals are scientifically known to increase blood pressure, and this elevated blood pressure will put a strain on your kidneys. All of this will eventually damage your bean-shaped organs, leading to kidney damage or renal failure. If you're not satisfied with your doctor's recommendation, there are multiple scientific evidences that have proven how damaging canned foods are for your kidneys. One epidemiologic study report shows that a high proportion of canned vegetables, especially tomatoes, can significantly increase your chances of getting kidney stones by up to 20%. So, what's the solution? A simple health tip is to minimize your intake of canned foods or look for ones that have low sodium content. It's always great to rinse them thoroughly to remove excess salt and protect your kidneys from major damage. Number 2. Chips and snacks. Here comes your all-time favorite snacks. Unfortunately, chips and pretzels can raise your blood sugar levels, leading to kidney strain. These baked and processed food items are rich in sodium and cause fluid retention in the body. What's worse? Some snacks have high levels of phosphorus and potassium, which are difficult to pass through the bean-shaped organs. This list also includes the brown bread and brown rice. All of these food sources promote fat storage in the body, and you feel a pressure on your kidneys. When a kidney patient eats too much snacks and chips, he ultimately lead to unhealthy fat storage and increased body weight. This can elevate the risk of obesity and various other cardiovascular diseases, including heart attack or stroke. The most damaging thing is these chips and processed foods often have low nutritional value and cause spike in your normal blood pressure levels. Studies have shown that a spike in blood sugar level is directly linked to kidney failure or chronic kidney diseases. You can handle this by choosing kidney-friendly snacks such as fresh fruits, which are low in potassium, vegetables, and unsalted nuts. This will help you manage your kidney disease and opt for a healthy diet plan. Number 3. Plant-based beverages. Who does not love the fresh cashew milk and oat milk? We all do, right? However, a high intake of these plant-based beverages can harm your kidneys. Coconut milk, oat milk, and almond milk have added sugar and sodium that is not good for kidney patients. These dark-colored drinks can lead to weight gain and diabetes, which further complicates kidney disease. Some plant-based beverages, like those made from almonds, can be high in oxalates. For individuals with kidney stones, particularly oxalate stones, consuming high oxalate foods and beverages can increase the risk of stone formation. Many drinks are fortified with vitamins and minerals, which can be beneficial for the general population but problematic for kidney patients. For instance, vitamin D and calcium fortifications, though beneficial for bone health, need to be carefully managed in kidney patients to prevent imbalances. Studies have shown that coconut milk is linked to kidney failure due to high potassium content. Therefore, healthcare experts recommend limiting beverages such as soy milk, almond, and coconut water. You should take an ideal quantity to maintain your kidney health and overall metabolism. Number 4. Bananas. Our next plant-based food sources are fresh fruits, including bananas. These are high in potassium and can lead to renal failure or kidney stones. In fact, a medium-sized banana contains approximately 400 to 450 milligrams of potassium, and excess potassium is a direct cause of chronic kidney disease. High intake of potassium can cause a condition called hyperkalemia. Hyperkalemia can have severe and potentially life-threatening consequences, such as irregular heartbeats, muscle weakness, and even cardiac arrest. For this reason, kidney patients are often advised to limit their intake of high potassium foods, including bananas. Managing potassium levels is a critical aspect of dietary planning for kidney patients, and avoiding bananas helps prevent the complications associated with hyperkalemia. Instead, kidney patients may need to choose lower potassium fruits and work with a renal dietitian to ensure their diet remains balanced and nutritious while maintaining safe potassium levels. Share in the comments how many bananas you eat in a day and what's your favorite fruit that you can replace with bananas for a healthy kidney. Number 5. Oranges. Oranges, like bananas, are another fruit high in potassium, with a medium-sized orange containing about 240 to 270 milligrams of potassium and a cup of orange juice containing even more, roughly 470 milligrams. This high potassium content makes oranges and their juice problematic for kidney patients. The primary role of the kidneys in regulating blood potassium levels is significantly increased in individuals with CKD, leading to the potential accumulation of potassium when high potassium foods like oranges are consumed. The consumption of oranges can thus contribute to hyperkalemia in kidney patients, posing serious health risks. Besides potassium, oranges are also high in vitamin C, which, in large quantities, can lead to the formation of oxalate crystals and potentially result in kidney stones, further complicating kidney health. For kidney patients, maintaining a diet low in potassium is crucial to avoiding these complications. Therefore, they are often advised to steer clear of oranges and orange juice, opting for fruits with lower potassium content. Number 6. Chocolate bars. You might need to think twice to remove or limit chocolate bars from your everyday diet. But the fact is, these energy bars are highly damaging for kidney patients due to their high content of potassium, phosphorus, and oxalates, as well as their sugar and fat content. These elements can elevate kidney problems and lead to further complications in individuals with chronic kidney disease or those on dialysis. Chocolate, especially dark chocolate, is rich in potassium and phosphorus, two minerals that kidney patients need to monitor carefully. Healthy kidneys filter excess potassium and phosphorus out of the blood, but impaired kidney function can lead to dangerous levels of these minerals. Elevated phosphorus levels can result in hyperphosphatemia, leading to calcium being drawn from the bones, making them weak and brittle, and causing calcium deposits in the heart, blood vessels, and other tissues. These conditions can significantly increase the risk of cardiovascular events and bone disease in kidney patients. Many commercially available chocolate bars contain additives, preservatives, and artificial ingredients that can be harmful to kidney patients. These processed ingredients often include additional phosphorus, which is used as a preservative and to enhance texture and flavor. So, the next time you eat chocolate, keep in mind you're risking your health at your own consequences. As we come to the end of this video, you should know that everything suits your body if it's consumed in moderate amounts. Besides these 6 plant-based foods discussed above, there are many other dietary options that you need to avoid for healthy kidneys. Let us know in the comments if you consume any of these food sources, and subscribe to this channel for more healthy updates and kidney-friendly life.